For some, childbirth is a natural, trouble-free experience.
Look at that!
For others, it's a matter of life and death.
Williams, please!
This high-risk maternity unit treats mothers and babies on the brink, changing perilous situations into stories of hope and survival. These are special deliveries.
Beautiful.
Miracles in the making.
It's a lot of excitement for one day.
At Ohio State University Medical Center in Columbus, student doctors and nurses work alongside their professors to save the lives of babies and mothers.
Still cold?
It's a little cool, but it's not cold.
Okay.
Mothers like 26-year-old Cindy Carter. Cindy was admitted 2 weeks ago with preterm rupture of her membrane.
When my water broke, I was really surprised because I was only 29 and a half weeks pregnant, so it was scary.
Medication and bed rest have delayed labor until today.
Right now I'm in pain, having contractions, just really bad cramping. It hurts pretty bad.
At just 32 weeks, her tiny newborn will likely have underdeveloped lungs and trouble breathing.
How bad was the worst contraction so far? Think you got up to a 10 out of 10?
No, not quite to a 10 yet.
Okay. What was the worst then?
It's probably about an 8.
Okay.
Because her water broke early, Cindy and her child are also at risk of a dangerous infection in the fluid and membrane surrounding the baby.
Some of the biggest signs that we look for are fever, increasing white count, and abdominal pain. So those are the things that we monitor in those patients who have rupture of membrane for a long period of time.
Any rise in these levels could signal a serious problem.
There can be fetal and mother compromise. Mom could get really sick from that kind of infection also. So definitely morbidity, mortality are increased with that infection.
Cindy is an experienced mother. She has 2 healthy sons. The family photo should show 4 children. But a terrible car accident took the lives of her 15-month-old son and her unborn baby.
It's hard not to be able to see them one last time, to say goodbye and to tell them that you love them. And it's very tough.
Cindy was badly injured in the accident, but has defied the odds, giving birth to son Alex.
He's so precious.
But the impact continues to plague her today because her spleen was destroyed in the accident.
I am prone to getting an infection, and it's harder for me to get rid of it, and the baby will be born early and his lungs may not be developed and he may have infection.
Get some gel. Hi, Mrs. Carter. Feeling more pressure?
A little.
Okay. Let's see what the cervix is doing. You're still 2.
Still 2.
Yeah, it's still pretty thick. 260 minus 2. Okay?
Okay.
You're doing it. She's starting to feel her contractions more, becoming more uncomfortable. So we were checking her cervix to see if she's making progress. She's only 2 centimeters, and she was 2 when she started. Average progression is, a centimeter or 2 an hour after you get in active labor. So we have some ways to go.
At 39 weeks, Wendy Swisher is ready to deliver her 3rd child.
Hello, how are you?
Fine, how are you?
Good, may I help you?
Yeah, my name's Wendy Swisher and I'm here for my C-section.
Okay.
Though she's been through it twice before, Wendy is anxious.
I'm scared because they have to cut into you and, there's a lot of risk involved and you just don't know what's going to happen until it's over with.
So you're here today for a C-section?
Based on her history, Wendy's fears are understandable.
Do that. Okay. First one was scary because my daughter, she was 10 pounds, but she was an emergency C-section. They lost her heart rate. When she was born, she'd swallowed her own bowel movement.
Here's your gown, and you can go into the bathroom.
Miss Swisher's rather heavy. On one of her C-sections, the obstetrician actually had trouble getting the baby out and had to have another obstetrician come help. And then the last time, there's a lot of scar tissue and trouble entering her abdomen because with the obese patient, the surgery is can be more difficult.
And there are other concerns.
Obesity is a risk factor. It's a risk factor from an anesthetic standpoint, from an obstetric standpoint. I mean, you have a bigger chance of getting blood clots in your leg. There's a bigger chance of surgical complications.
But this team is prepared for any emergency.
Do you have any questions or anything about the epidural, or do you need anything for pain relief yet?
No, not right now.
Okay.
Maggie Murphy has been at OSU Medical Center for 4 days.
I'm here at the hospital because my baby is exceptionally small, and she also has a heart problem with her aorta.
A condition detected just 4 days ago.
When they were doing the ultrasound to see if they could figure out why she was small, they realized that the aorta is narrower than what it should be.
The news was a shock.
The heart is the last thing, I wanted to hear.
Just let your knees go way up to the side there if you can. Let me check you here.
At 32 weeks, Maggie's induction is 2 months early. But doctors believe they can better care for Maggie's baby outside the womb.
Hopefully that I won't have any complications and that I'll be able to have the baby vaginally sometime within the day.
The baby's head is still high. We just need to get more contractions and get them stronger. Maybe like 60 or 70% thinned out, but the baby's head is high, so. Okay, so we're just gonna keep upping that medicine, okay? These things take time. Mother Nature wasn't ready for this and we're kind of forcing it to happen, so we just have to be patient, let the medicine work on your cervix and on the baby, so. Okay? Okay.
She's currently now in early labor. She's like 3 centimeters, and she has to go all the way to 10, so she has a long way to go still.
After a slow start, Cindy is finally in the last stages of labor.
Almost ready. I'm so excited.
Just gonna throw this off here a little bit. So we are all 10 centimeters ready to go. Okay, let's get everybody ready.
Yes, I am.
Hey! We just think the baby might be having some variables here, Sean.
Okay.
The baby's head is down, but Cindy can't push just yet.
When the baby's head gets squeezed, the baby's heart rate drops a little bit, so we're probably getting very close to delivery. We just want to make sure all the pediatricians are here, so since this baby's only 32 weeks, just to make sure that everything goes all right.
Alrighty.
Are you guys ready? Okay, you want to go ahead and push? We're going to have a baby here.
4, 5, 6, 7,
Call staff for delivery.
9, 10. Again, this is it. This is your baby coming right now. Let's push. 1,
Good
2,
job. Nice job,
3,
nice job, nice job.
4,
There you go.
5,
Here comes the whole
6,
baby.
7. Alrighty. It's a boy.
Here, I'll give you
It's
that.
a boy.
You got it? Harder than you think? Go ahead. We're going to hand this kiddo off.
You go.
Sweetie.
Baby's doing good now. He's crying. We're just giving him a little bit of oxygen to pink him up.
You didn't need us.
There you go. I'm just overjoyed. He just is so little and so precious.
But he's struggling to breathe. Tiny Elijah James Carter is rushed to the NICU, where the first 24 hours are critical.
150.
Elijah Carter is just minutes old and unable to breathe for himself.
Get that one in.
The reasons for the baby's breathing is twofold. One, adjusting to the breathing outside the womb, and the other is to have to inflate immature lungs. And at the same time, whenever a baby is born prematurely, we need to be aware of the possibility of having bloodstream infections. And that's the reason why we are going to do some blood testing and also give this child antibiotics.
While the NICU team works to keep babies alive, they're also aware of mothers' needs.
So this is very standard, and this is the very, very simple and practical way of alerting mom about the baby's condition and as well as to get him acquainted. I'll be right back, doctors. May I come in? Hello.
Hi.
I'm Dr. Cordero, and I have some pictures of a lovely, beautiful baby whose first name is going to be?
Elijah.
Elijah. Okay. As he does have toes, fingers, everything you like to have, and everything seems to be in order. However, his lungs are immature, and he's working very, very hard. I'm going to put him on a lung machine, what we call ventilators,
Right.
and that will help with the respirations so he doesn't get too tired with that.
Okay.
This is no unusual. Still have a very, very good chance of doing very well.
Okay.
But it may take a while.
In the hours and days ahead, baby Elijah will be under constant observation as things can take a turn for the worse at any moment.
Pull up here just a little bit, just so I can feel your belly. And I apologize for cold hands. Just kind of feeling to see where this baby's laying.
First-time mom-to-be, Danette Becker, is excited. The time for her C-section has finally arrived.
Nervous yet?
Yeah, I'm getting there.
Danette and husband Chris are in good spirits, considering what they know.
Our baby boy Brandon is having he has spina bifida, so we're going to take him by C-section and then take him over to Children's Hospital and have an operation done to close the opening on his back. So it's a lot going to be going on today.
Spina bifida is an incurable disorder that occurs when the brain and spinal cord don't develop properly in utero.
Children with spina bifida, in general, have normal IQs, do very well in school. They have problems with motor. By that I mean some can walk with braces, some can walk with crutches, some are wheelchair bound. You don't know that until much later. Some children have bowel and bladder problems because the nerves that control your bowels and bladder are also at the lower end of your spine too.
All right, sweetie, we're all done with that.
Danette learned early in her pregnancy that her baby had the condition, a disorder that affects 1 in 1,200 pregnancies.
Finding out he had spina bifida was very shocking. That's something that you're not expecting, especially with your first pregnancy.
There we go. Well, I guess the worst part is, there's a possibility he might be in a wheelchair and stuff like that. And, that'd be hard on a little kid growing up. Mom and I can deal with it, but it's just how hard it's going to be on Brandon.
Spina bifida can be such a devastating condition that parents are given the option to terminate.
They mentioned if we've ever thought of abortion. It's like, that's never ran through our mind. Just because he might have a little rougher time growing up, he still has a right to be born too.
All right.
Good with the hat on, Chris.
Haven't even gotten to me yet. She'll be there.
From this moment on, your life is never going to be the same. It's going to be better.
So much.
I got her Tetris. She's been
Okay, Dad.
She yells at the Tetris game.
Okay.
Can I have
My baby's having a baby. She's doing better than I am.
There goes Mommy.
Bye, Mommy. Love you, baby.
It's a bittersweet moment. A new family member is about to arrive, a little boy with a lot of challenges.
I'm going to do this 3 times.
A recent ultrasound revealed a heart problem with Maggie's unborn child. Maggie is starting to feel strong contractions.
Maggie, this is going to be that numbing medicine, the bee sting that I talked about. It's going to sting and burn. We're going to feel it right here. 1, 2, 3, sting and burn.
So an epidural is underway.
Now you're going to feel me working. If anything feels sharp, you just tell me. Relax your shoulders. You're doing perfect. She's doing much better. Her pain scale is down to a 2 right now, so hopefully she can progress on with her labor and the epidural will work for her.
You okay?
Maggie's pain can be eased, but her anxiety over how sick her baby may be can't.
I'm scared, I'm anxious, I'm nervous. I'm trying to take it all in, all at once, you know, and deal with it the best way I can and just see what the outcome brings me for right now.
Good. We'll just have to get you on your side.
Maggie's doctors break her water, generally a safe, routine procedure. But this time, something's wrong.
You know, labor can actually be kind of stressful for babies, and it's a dynamic process. Sometimes we do see decelerations in the baby's heart rate, something that we need to monitor. It's a cord phenomenon, we might say.
Sometimes babies can be laying on it, sometimes they can be squeezing it.
The fetal heart rate has dropped dangerously low. Maggie's baby may be pressing on its umbilical cord, cutting off its oxygen supply.
May be better.
Yeah.
Doctors move Maggie, hoping a new position will take pressure off the baby's cord. But the heart rate continues dropping. A normal heart rate is 120. It's a life-threatening situation for this unborn child.
Baby, I apologize, Nick.
Yeah. Okay, we'll just start getting moving. Let me tell folks what's going on.
I need help in here.
Yep, page low.
Get in here now, need help.
Baby's heartbeat just hasn't come back up after we brought this water. Hold on.
For Maggie, it's a confusing and frightening experience.
We're yelling different things at each other and saying, you know, don't do that and wait for this, and I don't know what any of it means because they're all talking in different codes and stuff.
One person come with her. Is that going to be Mom?
For some reason, it did not tolerate your water being broken. Whether that means its cord is just in an awkward place or not, it's hard to say.
With the clock ticking, an emergency C-section is called.
Call Williams, please.
I want to see the baby.
A blanket on Dr. Samuel's side.
I'm hoping he's healthy. I mean, he doesn't have too many problems. If he does have to go to NIC unit, he's not down there that long. It'd be hard if they take him away because you just want to be with him. You don't want him to take him.
You can have a seat there.
This will be Wendy's third C-section. That, combined with her large size, presents some specific complications.
What we see with obese patients, they actually have some unique problems. Her C-section will be much more difficult.
We're going to get a big baby, aren't we?
We're going to have to make a larger incision because we anticipate that the baby is going to be on the larger side. The one thing that we don't want to have to encounter is difficulty delivering the baby. There's a lot more body to work with, so we kind of have to have all hands on deck.
I'm going to grab what you stand for. Grab real good. Now keep it away from the skin, obviously. If you've had 2 C-sections, the third C-section is more difficult because of scar tissue. And with a heavy patient, it's just some of the tissues get in the way and you have to have more people retracting and making it easier to get in the case. Come in here, you can go both. Okay, both is good. It's a matter of teamwork and have everything lined up and prepared ahead of time.
Here we go, guys.
Come on, Mr. Bill. Mr. Bill, it's a baby. Look at those big cheeks.
Oh, look at all that. Look at the nose. Look at that nose.
Ready?
Okay, let's go, Captain.
Come on, baby. Act like shoulders, though. She can get the arm back. So it's good practice for shoulders. Okay, can you get up? See? There you go.
Hi! Hello!
C-section babies are often born with their mouths and lungs full of fluid. Fluid that would have been squeezed out had they come through the birth canal. So doctors routinely suction to speed up the first breath.
Is this a boy or girl?
Hi! Hello!
Oh my goodness.
Hello!
It's a man! Let's see. Whew. Look at the size of this kid. I don't know if he can handle it. Okay.
Here you go, Dad. There you go.
Okay,
Doctors discover something unusual that could have been dangerous.
knot in the cord. This is a knot in the umbilical cord. This is the kind of thing that if it gets tightened up, strangulate the kid and actually cause the kid to die.
Of the 3,500 births at OSU each year, doctors see only about 5 cases involving a knot in the umbilical cord.
And that's why I can't understand why some people say, well, I don't want any monitoring during labor, I want everything natural. I mean, this kind of things happen.
To make sure the baby is out as quickly as possible into a C-section. Okay.
With her baby's heartbeat dangerously low, Maggie has been rushed into surgery so fast that her epidural hasn't had time to take effect.
So we're going to be putting her all the way to sleep, so we can get the baby out as quickly as we can.
Whenever you have a potential cardiac anomaly as well as prematurity, and coupled with a decreased heart rate for an extended period of time, those are all reasons for concern for emergent cesarean delivery. Whenever the baby's heart rate is down, what you have to worry about is decreased oxygenation to the baby's vital organs. We moved pretty quickly, so if something would have delayed us, this could have easily ended up as a fetal demise quickly.
Can we open up another?
No. 912
All right.
Yeah, that's right.
Baby Naisha is doing well, but her suspected heart condition means a swift transfer to Children's Hospital.
Sounds good. It could be a series of heart defects, including what's called a coarctation, or kind of a crimp in the aorta, or it could be a stenosis of the valve of the aorta. And both of those would be very bad for this infant.
We're having such a good time here.
Danette Becker is about to deliver her first child, Brandon. She has mixed emotions.
Anxious now, a little more so than before.
Because this is no regular delivery. Baby Brandon has spina bifida.
You deliver him by C-section because the spine's open in the back and there's a sac covering the spine, and you don't want to damage that on the way out.
This open spinal area is fragile and at high risk for infection. So a sterile plastic bag will be placed over the lesion.
Here's the bag. Okay, give me the bag.
It's an extremely delicate procedure.
You'll take one in the bag. Okay, I'll take the other.
One, it keeps it from getting dirty, and two, it keeps the fluid from exuding too much from that area, which can cause babies to get dehydrated. Hi there. How are you? Dr. Shepherd. Do you have any questions?
Am I gonna be able to see him after he's all cleaned up and everything?
Yeah.
Okay.
Yeah. Okay. All right. Good luck.
I'm a little nervous. I just can't wait to see what's going on and make sure everything goes all right today.
Oh my goodness. Yes.
Cindy Carter's son, Elijah, was born 2 months early and has spent the first hours of life in intensive care. Cindy is visiting him for the first time.
I just want to hold him so bad. I know. So it was hard leaving him in there. They expect him to do very well and only be on the ventilator for a few days. It's just heartbreaking not being able to hold him. Bye, baby Elijah. Mommy loves you. Mommy be back to see you soon.
Last night, Maggie needed an emergency C-section, and her baby was transported by ambulance to Ohio Children's Hospital.
It's hard not being able to be with her. It's scary sometimes because all I can do is call.
Due to her suspected heart abnormality, baby Naisha and her mom remain at different hospitals.
I didn't even get to hear her cry or see her until like 2 hours later. And that was hard, you know, because then I only got to see her for like 5 minutes and then she was gone. So it's hard.
Baby Murphy came in and she was on room air, which means she doesn't require any oxygenation, she didn't require ventilation, which is very good for how premature she is. She doesn't have any blood pressure issues, she's breathing very well on her own.
5 miles away at Children's Hospital, 1-day-old Naisha is now stabilized. She's being assessed with an echocardiogram, a type of ultrasound for the heart.
Basically what we do is we take a complete inventory of all the heart structures as well as the vascular structures around the heart from a number of different views to see if there's any evidence of any congenital heart problems.
In this case, the images are telling an exceptionally positive story.
Actually, this is the aorta right here, the blue that you see, and it's wide open with unobstructed flow. It means it's normal. That was the part of the heart that was thought to be abnormal on the fetal study that was done, and it's fine.
This is news that Naisha's mother will be thrilled to hear.
She's doing great. You get to be right here in the corner. He's got your spot. We'll move him out of the way.
Don't traumatize this child at all. Okay. Remember, we want to make this incision large enough because that's the important thing here. It's not cosmesis. It's to make sure we don't traumatize this child at all coming out.
How you feeling there, all right?
Everything looks fine.
We're about to enter the abdomen. Uterine incision. You ready?
Ready?
Here it comes. Here comes the baby. Suction them out. Can I get something to wipe the face off with, please? Cord around the neck, uno times. Okay, you ready? Gentle, gentle, gentle. Gentle, gentle. There's the spina bifida right there.
There we go.
I want the bag. The shepherd happy. Okay. You got the baby in the bag. Wait a second. Okay, let the arms be out of the bag. Wrap it. Hand it face down toward Ed. Ed, we got a big clamp, one of our metal clamps.
Clamp, please.
There we go.
He's beautiful. We can't wait to get to hold him.
All right. We're just doing standard resuscitation stuff modified to do it sideways.
Yeah, basically keeping the baby dry, keeping the baby warm.
And you're gonna cry for us.
Doctors examine the size of the baby's defect, which can help predict the amount of future paralysis. The bigger the defect, the bigger the problem.
Sizable. It's hard to tell exactly what's there, but it's pretty big. It's fairly large.
In fact, it's one of the largest spina bifida defects these doctors have ever seen.
All right, little one. Okay, we're gonna wrap you up. I'm gonna call for transport, and you're gonna go get to meet mommy.
Yeah.
Yes.
Can I send forklift?
He's doing great.
Oh, good.
He's doing great.
Hey, my sweet little boy.
Now it's a matter of wait and see. Will the spinal surgery be successful? How much damage is there? And will this infant ever walk? Answers not even the doctors have yet. Just 4 hours after delivery, baby Brandon is headed for surgery to close an opening on his spine.
Oh, I'll get that. Thank you.
I'll see you later, okay, baby boy? It's okay. I love you. Mommy loves you too.
The procedure can't fix any nerve damage, but is critical to close off the exposed spinal material.
Getting the skin over this to protect it from infection. It's really the only thing we can do.
It's a delicate procedure.
What we have here is the spinal defect. This is the splayed out spinal cord that is part of the primary defect of spina bifida. Our job is to clean this area off and fold this nervous tissue inside into the normal space and close the skin.
This operation must be done within the first 24 hours to give little Brandon the best chance of survival.
What we do first is dissect out the neural elements so we can preserve them inside what will soon become normal dura to this child.
That's a little nerve-wracking. That's for sure. I called Mom and told her when I went in surgery, so she's expecting a phone call as soon as the doctor comes out.
Here is the neural element, some of the nerve roots that are still persistent.
As doctors prepare to place Brandon's spinal tissue back inside his body, their goal is to prevent infection. The surgery is dangerous. Without extreme caution, it could cause additional spinal cord problems and brain damage. 3 long hours later, the surgery is complete.
Everything did real well.
Good, good.
The covering we made around the spinal cord elements is good and healthy, and the skin looks real healthy, so baby should heal fine.
Good.
Now he'll be down here for an hour or so while they make sure he's breathing okay. They think they're going to be able to get him extubated, and then you'll be able to see him on the 4th floor in the intensive care unit.
Okay, could you tell if there's a lot of nerve tissue involved?
The nerve tissue is just as it was before. It's basically from where the level is down, and we know that it's pretty high, so there's not a whole lot from here down.
Yeah.
Arm-wise, baby's super. And like I said, good-looking head, normal-looking head at this point, which is a very good sign in terms of brain development.
Good, good.
The first of many hurdles in this family's new and challenging life is over.
He's doing all right, and still have to kind of wait and see how much, movement he has in his legs. But regardless, he's a wonderful little boy. He's doing good, and we're happy to have him. We're excited.
Mickey Reed is pregnant with her second child. At last check, 2 hours ago, Mickey was 5 centimeters dilated. An epidural has relieved her pain, but her contractions are now coming strong and fast.
Okay, can you pull your knees up for me? Can you bend them with your epidural? Good. You feel that? Pressure. Oh! Guess what? You're complete! Yeah!
That's good news for Mickey.
I hope that she comes out okay. I don't want it to be like it was when I had my son, because I was in labor with him for 21 hours, and I had to have a vacuum at the end of my pushing because his heart went into distress after being in labor for so many hours. So I just hope I don't have to go through that with her. I just hope I can just push her on out and everything is okay.
After her first childbirth experience, Mickey's had other concerns. Her 18-month-old has epilepsy.
I've been hoping and praying that she's just healthy, no complications, no medical problems, no nothing. Just a perfect little baby.
Mickey, just relax.
It's been a fast progression, keeping this medical team on their toes.
There are risks with a quick change and a quick descent of the baby, and one of the things we watch out for is a shoulder dystocia, which can be pretty serious. That's when the head comes out and then the shoulders don't come out, they get stuck.
Hold it.
Push your legs back, Maggie.
Push.
That's it.
Good job. Push, 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 push. 7, 8. Right. Keep going. Let that air out. Deep right there. Grab hold of your legs. Let her grab her legs. 3. Excellent, excellent. 5, 6, 7, 8, 9, 10. Blow that out. Okay, sweetie. Lift your head for me. Okay. Nice, slow, deep breaths while you're relaxing, okay?
Are you doing okay? Okay, hon. When you feel your next contraction, we'll push, okay? Feel a contraction? You feel it?
Yep.
Okay,
Deep
big breath in and push.
Bear down.
1,
Excellent.
2,
Keep going,
3. Here comes 4, 5.
Keep going,
6,
sweetie. Hold it, hold it, hold
7, 8, 9, 10. Okay, hold it. Head's out.
Baby's head is out.
All right.
Couple deep breaths.
Suck it out.
In and out, in and out. Excellent. You're doing great, sweetie.
You're doing a good job.
Push again.
Nice, sweet. Okay, give me a push.
Her shoulders.
Easy.
Push, 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 push.
That's it. Pull your legs
Good
back.
job, Mickey.
Push, Eddie. Good job. Good job.
It comes. Look down at your baby, Mickey. Here she comes. Look down.
Who's gonna cut? I will. Okay. Come over here. Right there between. Between. Oh, what's her name?
Tony.
Tony. There you go. It's kind of chewy. Oh. Okay, Mom. Here she is. Oh, sweetie pie.
Oh, look at finger.
Maggie was relieved to hear that her baby's heart is fine.
Oh, look at her, Mom. Her eyes are all open. Oh.
Preemies tend to like what we call firm touch. Like instead of the stroking, they like to be kind of held like that, or if you hold her hands together, she really likes that. Hurt her? Nope.
Oh, look at her shaking. Like she just grab a hold of my finger. I'm nervous.
Maggie will visit her baby here in intensive care for at least a month before she can go home with her very special delivery.
This is one of the best days I've had in a long time. They said that she's doing real good. Like she eats out of a bottle just fine, and she's breathing on her own just fine. So all around it's not even like she's a preemie besides the fact that she's small. It is a miracle.
You have it ready?
I dropped.
Mickey, you want to see how much she weighs? 7 pounds, 10.5 ounces, Mickey. Warm up, Macy.
I'm due October, so I'm like, oh wow! Awesome.
Another miracle. Another blessing. And it's over. It's over.
.154 heart rate.
Perfect. Perfect. Excellent AFGAR. She's breathing well. Her temperature's perfectly normal. Sometimes they're a little chilly from being wet, but she's doing really well. Her tone is good. We'll wrap her up and give her to Mom. Come here. How does that feel, Miss Tony? Do you know? You know? There you go. Here's your little girl.
Cutie. Is that stuff going to hurt her eyes?
That's an antibiotic ointment to protect her eyes from any kind of infection.
Hey, Mama. Oh, well, excuse you. Don't come out being like your brother now. For real.
Hi, Eliza. What are you doing today?
Baby Elijah Carter has been receiving round-the-clock intensive care from the OSU neonatal team.
You gonna open them eyes? Yeah, you gonna open them eyes? Oh, stretch. Been stretching a lot today. Today I've been discharged from the hospital. I get to go home and I get to see my little boys. I get to see Kristen and Alex. It's very emotional going home because I do have to leave Elijah behind. But he will be taken care of. The nurses will do a good job taking care of him. Mm-hmm. So your big brother just wants to hold you. He has to wait for a little bit longer.
Elijah's brothers, Creston and Alex, are meeting him for the first time.
He's so awake now. Yes, see your big eyes?
He has a little head, little everything. He's got blue eyes, and he's cute. It's really cool.
Yes, you get to see Kristen and Alex.
For Cindy, who suffered the devastating loss of 2 babies and might have lost this one too, Elijah is a true blessing.
That's a lot of excitement for one day.
This is baby Swisher. His name is Keegan. He initially had to go to NICU, neonatal intensive care for. He's been down there since he was born. He had some, he was breathing kind of fast.
Keegan is now breathing unassisted and today graduated to the Well Baby Nursery.
Hi, buddy. Hi. We're just scared there for a little while, but just his breathing and stuff, and they didn't know if he'd pull out of it or not, but he did, and then they told us he might be here for a week, 2 weeks, we didn't know. And I just didn't want to leave him behind and go home. Hi, guys.
Fortunately, Keegan's stay in the nursery is brief.
We're gonna finish getting everything packed up and we get to go home, finally take him with us. It's an exciting day. Finally get to get out of the hospital.
Okay, is he gonna quit eating long enough to go in the car seat?
After a bumpy start, Wendy's baby is healthy and no doubt happy to be part of this loving family.
He's doing great. And he hasn't had any problems since I took him off the oxygen. He hasn't had any relapses or anything like that, so everything's fine. He's a very special little boy. Come on, buddy. Come over here to the elevator, sis. Come on.
She's being very good.
Mickey Reed's baby is about as healthy as a newborn can be.
She's doing fine. She's doing great. It's a perfect little girl. Beautiful little shaped head.
You gonna wake up? I'm just happy that she's here now and she's healthy. I'm happy and relieved. Thank God that she's here. Thank God that she is here. I got some food. Yeah, you heard food and you started grinning. You should be awoke.
He's so cute. Yes, you are. You're just adorable.
Born with spina bifida, baby Brandon Becker is recovering well from his surgery.
He's doing very well, actually. Everybody's very surprised, really, how well he is doing. Determination is what he needs to get through everything, and he definitely has it. Even now, only being a week old, we can tell.
I'm not really awake.
Little Brandon faces ongoing treatment, additional surgeries, and extensive therapy for his condition. There are still plenty of unknowns, but for Danette and Chris Becker, one thing's for sure.
We're just happy to have him here. He might have some challenges and stuff that he has to face, but that only makes him a stronger person, and maybe in the future he'll help other people out too. And maybe they look at him and say, well, he can do this, you know, there's no question that I can do something. So we're just hoping he's going to be a little inspiration to other people.
All the uncertainty, the pain, the fear of a high-risk pregnancy.
You can open your eyes now.
Certainly worth it once a mother stares into the innocent and remarkable face of her very own special delivery.